We're delighted to have so many of you here who've given up a day to spend the day with us at this conference on partnerships in global health. The wonderful thing about putting a conference together is that we're able to put a conference that we'd like to come to. So we're so grateful that so many of the people that we wanted to hear from have all accepted our invitation and have come to talk with us and share their ideas with us today. So we are very grateful. Just to introduce myself, I'm Fleur Kitzel, and I run a program as part of a team. We're based in Health Education England, the Wessex area team, and the Thames Valley and Wessex Leadership Academy. And we run a program where we recruit individuals who spend some time with a partner organisation overseas. And we've been running that program since 2008, and we're delighted that all of our current partners have managed to come and spend the day with us, representatives from those organisations. So we are delighted to have them with us, and so welcome. So without further ado, I'd like to introduce Ben Sims to give our opening speech. Thank you very much.
Thank you very much, Fleur, and thank you to the Thames Valley and Wessex Leadership Academy for inviting me to speak. Very many congratulations to you all for putting such an impressive conference together. I'm especially struck by the large number of overseas visitors that are here, which is really exciting. I've been asked to provide a general introduction to the theme of partnerships in global health, looking at, in particular, at the concept of mutual benefits. My hope is that this will provide some context for the more detailed conversations that will follow throughout the day. The thinking behind mutual benefits and health partnerships is, of course, not new, but it's perhaps heard more about today than ever before. I would say it's evolved through the thinking of our THET's founder, Professor Eldred Parry, who talked about the willingness on both sides to learn. And it's evolved further through the work and thinking of Nigel Crisp and the concept of co-development, which I think is a fabulous move on from the idea of international development, the doing to, moving to the doing with. To the current government, which in its paper published just before Christmas, entitled UK Aid Tackling Global Challenges in the National Interest, talked about the stability, security, and opportunity that will benefit us all. Today, my own personal favoured definition of health partnerships has mutual benefit at its core, and I'm sharing it up there with you. But there you see the idea of co-development, you see the idea of long-term, but not necessarily permanent, and you see at its core the idea of reciprocal learning and mutual benefit. This year is a really exciting juncture for those of us involved in the health partnership movement. And I think there are three things that I'd like to highlight in particular. First, we have a UK government that is giving unprecedented support to the concept of linking UK institutions with institutions overseas. So it was Conservative Party manifesto commitment, and you'll see I've already quoted from the document produced before December. So there is some good news here. Secondly, of course, we live in a very changed world. So no sooner have we recovered from the shock of Ebola than we're faced with Zika. And of course, Ebola and Zika are just long lines after SARS, swine flu, HIV and AIDS. So we, from my perspective, may have been slow over the past 30 years to grasp the truth that the health of one nation impacts directly on the health of another. But we recognize that truth now. And the world has changed fundamentally because of it. And thirdly, I would say we have an unprecedented ambition as expressed by national governments to deliver universal health coverage to its citizens. This is best expressed, of course, in the adoption of the Sustainable Development Goals. And at the heart of these development goals, have no doubts, is the aspiration to recruit and train 13 million more health workers than we currently have by 2035. So the most important part for me of the Sustainable Development Goals is traditional approaches to aid and development will not deliver that ambition. They will not bridge that gap. We've got to do things differently. Nor do traditional approaches, I think, adequately recognize that expertise now resides in every place, in the global south as well as the global north. So for both these reasons, I think we're at a stage where the world is listening and wanting fresh new ideas, and that's what I think we're part of here today. So, as I've said, under the leadership of Eldred Parry, THET has been at the centre of the mutual benefit approach since we were established in 1989. But today, we're probably best known for the Health Partnership Scheme as the custodian of this scheme, which was launched in 2011. This is £30 million of UK taxpayers' money being spent on connecting people within the NHS and health institutions overseas in low and middle income countries. It's a fascinating, diverse funding stream ranging from £5,000 travel grants to over 1 million multi-country programme grants. Well over 100 UK institutions have been involved, and over 1,700 NHS staff have been involved, volunteering 54,000 days of time in the last 4 or 5 years. The vast majority of these health partnerships are having a considerably beneficial impact, with 91% of tested training showing improved skills or performance. 172 developing country institutions have improved medical equipment, ICT or health information management systems, and over 400 national and institutional strategies and professional standards have been developed. When this scheme was launched, we were expecting to reach 13,000 health workers. Today, we're reporting 50,000 health workers reached. And of course, those health workers go on to train many more. In short, this scheme is doing immeasurably good for people living in low and middle income countries. People like Angelina, who's a psychiatric nurse who received training from the Department of Health Sciences at York University in a partnership with Zomba Mental Health Services, and who is now training others. So I particularly like Angelina because this is leadership from someone who has the lived experience of having a mental health problem, but is now taking up a leadership role within her community. She quoted to us, "It felt good to be asked, because mental health service has been sidelined in Malawian communities. If we impart knowledge to our colleagues, then we can help our community." Or people like Dr. Yin Ying Ang, a paediatrician trained by the Royal College of Paediatrics and Child Health in partnership with the Myanmar Paediatric Society. Dr. Yin Ying was one of the instructors of a recent THET Plus course, and I think you'll hear more about that later today. But she says, "I attended the THET course in July 2015, and from that I became an instructor. I love teaching, and also think that the teaching style of the course was very good. The main thing is how to give knowledge to others so that they can change their ideas in practice. I delivered THET Plus training in Saigon. There were 27 participants, including 7 doctors and 20 nurses." And so there we see the kind of cascade effect of someone who's trained, put in a leadership role, and cascading that to others. But the Health Partnership Scheme is also doing immeasurably good for the NHS, for us back in this country. And that is what I want to focus on a little bit with my limited time. Looking through the lens of leadership training, which is, of course, the focus today, I want to look in particular, Flo, you'll be glad to know, at the work of the Improving Global Health through Leadership Development as a case in point. And just, this is one of my favorite videos, so forgive me, 1 minute and a half.
Too much in the NHS, unfortunately, is a lot about service provision, and although we're training within our roles, you're training to be excellent clinicians, but some of the other skills, such as leadership skills or management skills or teaching skills, have to run alongside you training as a clinician. Whereas within a lot of other professions, you'd be given the time to kind of nurture those skills individually in their own time. And that's what IGH provides. It provides that real opportunity to nurture the leadership skills and to focus on them and actively learn from them whilst kind of away, so in Cambodia or Kenya or wherever you choose to learn. And actually giving that freedom of time is really what I think you reap the most benefits from. And actually in the longer term, what you then take back to the NHS as a leader is far more valuable than the kind of snippets of passive learning that you pick up alongside the rest of your training or studying for exams or, you know, interviewing for your next post.
If I was asked to go and talk to the Secretary of State for Health and say to them, and talk to them about this programme, I would say take real notice of this. You know, really look at this, because it's this kind of stuff, these skills we learn here, that I think can go such a long way back home. And I've been here 5 months, and I've learnt more in 5 months about leadership and service development and all these really key skills than I've learned in 5 years in the UK.
So that's a great quote, isn't it? Absolutely brilliant. Dr. Charlie Gardner. He's here. Where are you? Oh, you're even more famous now. Very good. And those testimonies by video are reinforced by the quotes we get back and compile at THET. And here are some of the, we have quite a lot, so here are just 3 examples. Direct benefit to the UK, that sense of career advancement because of the skills they've picked up, and how that's influencing further afield. So 2016 is absolutely pivotal year for the health partnership approach, and we at THET see 3 challenges in particular. The first is the challenge of learning and evaluation. So last week, DFID launched a £400,000 evaluation of the health partnership approach. This is obviously a critical test of the funding stream that I've already described. And what we're hoping to see is proof of concept. It's an extremely good sign that DFID is spending so much money on this, because we're going to get a really valuable piece of thinking as a result. But in parallel with DFID's evaluation, I'd like to highlight particularly other aspects of work that THET is doing, and the Globalization in Health series is one that's, I think, worth mentioning. We were very pleased to discover that our initial calls for papers generated interest from all over the world, and a great diversity of health specialities and approaches represented. The series is intended to be an ongoing collection of evidence, reflections and challenges. We've begun with 6 articles, but we're hoping for more. Has anyone read any of them? 1, 2, great. I'm 3, 4. I'm really pleased I've mentioned this then. But the point is that please read them, but also contribute. We really, really want to get this evidence into the public domain. And if we don't, then how on earth can we expect DFID to renew its funding and increase its funding? So secondly, I believe we face a challenge to demonstrate that the health partnership approach is anchored in sound development practice, in our best understanding of how development takes place in lower and middle income countries. So in this context, I want to highlight the Principles Partnership, which is a series which Graham will be focusing on later today, my colleague Graham. But the principles on our website are not just a sort of list of phrases, but they're a hub for a growing, carefully compiled array of tools and of case studies. So on there you can click onto each of those principles and then uncover further information. It's vital that we as a community are able to work effectively in the international development space, and that our work is anchored in a sound analysis of what the ministries of health in those respective countries actually feel they need. THET itself is responding to this by producing resources such as Principles of Partnership and by significantly increasing our in-country presence, with new offices opening in Uganda and Tanzania from April the 1st. And together with our existing presence in Zambia, Somalia and Ethiopia, staff there will be a resource for you, will be a partner to you. But thirdly, I believe we face a challenge of ambition. I encourage you to join THET and others in making the case for a substantial increase in funding for the health partnership approach. In the current scheme, we are only able to award £1 for every £7.50 that's applied for. And I'm not saying that all that extra application is brilliantly well thought through projects, but a lot of it is. And a lot of time I see colleagues who are really struggling to say no, because actually the no comes from the fact that we haven't got enough funds, as opposed to, you know, a judgment on the merits of the projects. So it's really important that we reveal the potential. And I think the health partnership approach should be a defining offer from the UK to countries embarking on the venture of universal health coverage. And that's the moment we'll hope to hit when we reach the other side of the DFID evaluation in October of this year. And of course, all of this is taking place in very difficult circumstances back here in the UK. And one of the most exciting initiatives I feel I've been involved with since I joined THET 7 months ago is the partnership with the Global Health Exchange run by Professor Jed Byrne. This is finding expression in the sharing of ideas and also a close collaboration in our work in Uganda with the Global Health Exchange work around the UK-Uganda Health Alliance, concentrating on the supply side, and THET with its in-country presence concentrating on the demand side. I think it's never been more important than it is today to demonstrate mutual benefit in the context of today's NHS and the strains it's under. And I know of no one better qualified to talk about it than Jed Byrne, so I'm very glad that he's speaking next. So in my talk, I feel I've sort of encouraged us to be absolutely unashamed about the concept of mutual benefit and to use that lens to look at global health work. I think mutual benefit is not a distraction from the noble cause of helping others. I think it is the glue that will keep us investing in each other's development. It is what will bring new people and resources into the global health space, and by so doing enable us to significantly accelerate our ability to deliver the right to health to the world's citizens, remembering that as we stand today, 1 in 7 people on this planet will never meet a qualified health worker. Thank you for your time.
Yeah, I'm Marion Jacobs. I'm from South Africa. Thank you for a lovely presentation. I just wondered whether THET looks at, in looking at bi-directional partnerships, whether you also look at taking people from low and middle income countries and bringing them to the UK. I heard what Charlie had to say, that they're unlikely to learn a lot about leadership if they come here. But I do think you have phenomenal leadership programs which people from other countries might learn something about.
Yeah, I feel I need to apologise, Charlie, now. How can we erase that from public record? Yes, of course, and many of our health partnerships do, and you're witnessing that today. And in fact, Jed will talk more, I think, about that in interesting ways in a moment. And yeah, make no mistake, we're very, very proud of the NHS in this country.
I'm Itai Nyamatore from Northamptonshire. My question is the learning on the NHS. I'm a senior manager within the NHS myself, and a lot of good work is being done by our staff who go abroad and come back. I wonder what work can be done within the NHS organizations as organizations to actually help them learn from those members of staff who will have gone to work abroad. Because it looks like when they go, they come back with information and that's it. They can influence the system within the NHS.
It's a bit hard for you, isn't it?
I think, yeah, that's quite hard for me because what gets me out of bed in the morning is what's happening overseas. And Jed will talk again to this, but THET's very much part of a community of NHS institutions which is trying to formalise the NHS's engagement in global health. And part of that challenge, of course, is to get more systematic about how the benefits derived by individuals are then cascaded into benefits for the NHS institutions as a whole. We're on the case. Jed will come up with some more ideas.